Welcome back. Dr. Paul Hunter joining us on the show from the Columbia Summit Vet Hospital. Welcome to the show.
Hi.
How are you?
Good, thanks.
Good. We have Gus joining us as well. He's a bull mastiff puppy, is that right?
Yeah.
He's so cute.
English
mastiff.
No, English bulldog.
Okay, I got it wrong all the way around. English mastiff.
Bulldog.
English bulldog. I'm just going to stop talking. Let's just focus on how cute he is. How old is he?
He's 13 and a half weeks, I think the owner said.
And his name's Gus. Look at how sweet he is. Look at his little nose. He's delicious.
He wants to be in the movies, so
Does
he's
he?
starting here.
Oh, that's a good start. So we have Gus joining us today because he's a puppy, and puppies right now are needing to be careful because there's a kennel cough going around.
There's a little epidemic of kennel cough, which is a bacterial infection in dogs. It causes cough and can be quite severe in some till they're vomiting and sick. And it's dangerous in old dogs particularly, and young dogs are obviously, you know, less immune exposure and more trouble if they get sick. So we try to protect them all with vaccination. So respiratory infections, you know, they go through mingling dog populations pretty quickly if they're A, not protected, and B, you know, and maybe in the younger dogs. So there's, you know, we've been seeing a few dogs a day at our clinic, and we're not the largest clinic in town. So I think there's been an awful lot of dogs getting sick. And you can't attribute it to anything except the fact that there's the bacteria's making an appearance in the dog population, and it spreads quickly amongst unvaccinated dogs when it gets going.
Does the dog actually cough?
Oh, they cough a dry honking cough until they kind of gag or vomit, and when they're getting bad. And it's something that we encourage our clients to vaccinate their dogs for. But of course, you know, it's always tough to preclude every eventuality. And then there are the other possibilities of other bacterial infections that look like kennel cough. There's quite a number of them, in fact, strep and staph and pastorella and parainfluenza, but we really only are able to vaccinate for bordetella, which is kennel cough, and parainfluenza. And even there are different strains of the bacteria in bordetella. But the vaccines are protective, although you'll see perhaps in a tougher strain a little more coughing, a more of a coughing episode in a vaccinated dog, but it should clear with a bit of time typically.
Tell me this, what's the worst case scenario for people who don't figure out that their dog has kennel cough and they go untreated? What can happen? Well,
I mean, we have dogs coming in that are coughing till they're vomiting and appear to be quite sick and miserable. In an older dog, they could get pneumonia or some complicating infection because of it, and you know, those are the less frequent things. But you know, it's like in people, we encourage vaccinating for the flu amongst older people to avoid them getting life-threatening illness. So it's similar to that.
Okay, is this a springtime thing? Do you see it in the spring?
No, it happens all the time. You know, it happens anywhere through the year. It's just we have these episodes where it appears, and sometimes it's very small and minor, and other times it happens quite quickly and goes fast. It's probably worse in the summer and spring months when people are more active outdoors with their dogs and more socialization. Okay. And they pick it up with exposure nose to nose or drinking out of a water dish that another dog has used.
Right.
And or just being in the same premises as another dog when they happen to lick the same toy or something.
Sure.
So in these episodes, it's better to be a little less socially active and you know, ensure that your dog's vaccinated.
Yeah.
And in fact, I was reading a thing earlier today where young dogs like this, there's some evidence that vaccinating them with an oral vaccine, which is one we use, and then an injectable vaccine at the same time can actually give a better immunity and kind of guarding against the onset of the disease in the tough conditions.
Okay. All right, so if you're noticing a cough in your dog, you know you haven't really been vaccinating properly, don't wait too long. Come in
or don't wait for that. If your dog goes to daycare or is going to be boarded through the summer holidays or in your holidays, you know, make sure your dog's vaccinated. Most kennels will encourage the dogs to be require the dogs to be vaccinated. And sometimes we let our guard down and then things get messy, and maybe that's what's going on. I don't know.
Sure. I think Gus is ready for a break. What do you think?
Yeah, he wants to. Maybe he's not going to make it in the movies.
He needs some water or something, maybe. He just needs a little break.
I think he needs the fun.
Dr. Hunter, thank you for being here today. If you have any questions about kennel cough, if you have some concerns about your pet in your house, you can certainly make contact with Dr. Paul Hunter. The website's on the screen. We're back in 2 minutes. Stay with us.